Before I call Jonathan Ashworth to ask his urgent question, I want to remind the House that Erskine May states that good temper and moderation are the characteristics of the parliamentary language. While the context in which particular phrase is used is important, Erskine May also says that there are certain expressions which, when used in respect of other members, are regarded with particular seriousness, generally leading to prompt intervention from the Chair and often requires on the member to withdraw the words. One example is making a charge of uttering a deliberate falsehood. In other words, members should not accuse other members of lying. Depending on the context, it may well be in order to quote the views of others, but members should not themselves state or imply that other members are lying. There are ways in such issues can be debated in the House by means of a substantive motion, but not part of an urgent question. I now call Jonathan Ashworth to ask his urgent question.
Ask the Secretary of State for Health to update the House on the pandemic preparedness of the Department of Health and Social Care.
I now call the Secretary of State for Health, Matthew Howe.
Thank you very much, Mr. Speaker. And, Mr. Speaker, what we've done to handle this coronavirus pandemic has been unprecedented in modern times. Throughout, we have been straight with people and straight with this House about the challenges that we as a nation face together. The nation, in my view, has risen to these challenges. Of course, there were unprecedented difficulties that come with preparation for an unprecedented event. But, Mr. Speaker, this pandemic isn't over yet. Our vaccination programme has reached 73% of the adult population, but that means that more than a quarter still haven't been jabbed. 43% of adults have had both jabs, but that means that more than half are yet to get the fullest possible protection that 2 jabs gives. Yesterday, we saw 3,180 new cases of coronavirus, the highest since the 12th of April. But thanks to the power of vaccination, in which I have always believed, the link from cases to hospitalisations and to deaths is being severed. Around 90% of those in hospital in hotspot areas have not yet had both jabs. So the continued delivery of the vaccination effort and the ongoing work to control the virus through testing, tracing and isolation, these are vital. Yesterday, we saw the opening of vaccinations to all those aged 30 and above. And I'm delighted to tell the House that the vaccination programme is on track to meet its goal to offer a jab to all adults by the end of July. And, Mr. Speaker, it has met every goal that we have set. Because setting and meeting ambitious targets is how you get stuff done in government. We have many challenges as a nation still to come. I know, and one of the things I've learned, is the best way through is to work together with a can-do spirit of positive collaboration. The team who have worked so hard together to get us this far deserve our highest praise. I am proud of everyone in my department, all those working in healthcare and in public health, the armed forces who fought on this home front, the volunteers who stood in cold car parks with a smile, colleagues across the House who have done their bit, and most of all, the British people. And whether it's the science or the NHS or people queuing for vaccines in their droves, Britain is rising to this challenge. We have come together as one nation and we will overcome.
Senate Secretary of State Jonathan Ashworth.
Mr. Speaker, families who lost loved ones will have noticed that the Secretary of State in his opening remarks did not respond to any of the specific allegations from yesterday. Allegations which are grave and serious, that the Prime Minister is unfit for office, that his inaction meant tens of thousands needlessly died, allegations from Dominic Cummings that he specifically is accused of misleading colleagues, an allegation from Mr Cummings, Mr Speaker, on our preparedness and lack of protection for people in care homes. Now, these allegations from Cummings are either true, and if so, the Secretary of State potentially stands in breach of the Ministerial Code and the Nolan Principles, or they are false, and the Prime Minister brought a fantasist and a liar into the heart of Downing Street. Which is it? Families who have lost loved ones deserve full answers from him today. Is he ashamed that he promised a protective shield around care homes and over 30,000 care home residents have died? Why were 25,000 elderly people discharged from hospitals into care homes without any test? Did he tell Downing Street in March that people discharged from hospital had been tested, even though it wasn't until 15th of April that there was a requirement for testing to take place? In public, he has often claimed that little was known of asymptomatic transmission at the time, so testing wasn't necessary. But Sage in January flagged evidence of asymptomatic transmission. A study in The Lancet in February flagged it. On March the 5th, the CMO said there may well be a lot of people who are infected and have no symptoms. So why didn't he insist on a precautionary approach and test all going into care homes? On 6th of May at the dispatch box, he claimed that it is safer for them to go into a care home. 12,000 people had died in these early months. How could he justify that comment? In April, he told the House that what is important is that infection control procedures are in place in that care home. But care homes, like the NHS, struggled with the most desperate of PPE shortages. And he was telling us in March from this dispatch box that supplies were extensive, but apparently in private in Downing Street was blaming Simon Stevens for lack of PPE. But the reality is him and his department was responsible for PPE, and the NAO report said the supplies were inadequate. 850 healthcare workers died. How many could have been saved had they had PPE? Families loved lost ones and have been let down by this government, this Prime Minister and this Health Secretary. But the truth matters. These families and the country deserve clear answers from the Health Secretary and the Prime Minister today.
Secretary of State.
Thank you, Mr. Speaker. These allegations that were put yesterday and repeated by the Right Honourable Gentleman are serious allegations, and I welcome the opportunity to come to the House to put formally on the record that these unsubstantiated allegations around honesty are not true, and that I've been straight with people in public and in private throughout. Every day since I began working on the response to this pandemic last January, I've got up each morning and asked, what must I do to protect life? That is the job of a health secretary in a pandemic. We've taken an approach of openness, transparency, and explanation of both what we know and of what we don't know. I was looking at it this morning. Since last January, I've attended this House, Mr. Speaker, over 60 times. With the Prime Minister, we have together hosted 84 press conferences. I've answered 2,667 contributions to this House and answered questions from colleagues, the media and the public. And we'll keep on with this spirit of openness and transparency throughout. As well as coming to the House today, I'll be answering questions and hosting another press conference later. Now, sometimes what we've had to say hasn't been easy. We've had to level with people when it's been tough, when things have been going in the wrong direction. And also, we have learned throughout. We've applied that learning both to tackling this pandemic and making sure that we're as well prepared in the future as possible. But beyond all this, what matters remains the same. Getting vaccinated, getting tested, delivering for our country, overcoming this disease and saving lives. And that is what matters to the British people.
Let's go to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The House should know that when at yesterday's joint Select Committee hearing, serious allegations were made, we asked for evidence to be provided, and until such evidence is provided, those allegations should be treated as unproven. In the meantime, we are in the midst of a pandemic, and we need the Health Secretary to be doing his job with his customary energy and commitment. So I want to ask him about comments made this morning by Neil Ferguson on the Today programme. He said that the Indian variant is now dominant in the majority of local authority areas and indeed is the dominant variant of the virus. and that June the 21st as an opening date was now in the balance. Given how desperate businesses are up and down the country to return to normal, what additional measures can he take in the short term to make sure, in terms of surge testing, in terms of the vaccine rollout, in terms of improvements to test and trace, that we really are able to open up, as everyone wants, on June the 21st?
So State.
Thank you very much, Mr. Speaker. Well, it is true that the Indian variant is spreading across the country, and estimates vary as to what proportion of the new cases each day are the variant first identified in India, which is more transmissible. Now, my assessment is that it is too early now to say yet whether we can take the full step 4 on the 21st of June. Like him, I desperately want us to, but we will only do that if it's safe. We will make a formal assessment ahead of the 14th of June as to what step we can take on the 21st, and in that we will be both driven by the data, we will be advised on and guided by the science, and we will be fully transparent both with this House and with the public in those decisions. That's the approach we've taken, that's the approach he and his Select Committee would expect, and it's what we'll deliver.
Let's go to SNP spokesperson Martin Day. Martin.
Thank you, Mr. Speaker. In Dominic Cummings' opening statement yesterday, he said that the truth is that senior ministers, senior officials, senior advisers fell disastrously short of the standards that the public has a right to expect of its government in a crisis like this. When the public needed us most, we failed. We then heard a litany of evidence that the disease wasn't taken seriously in February last year, further compounded by the ignoring of sage advice in September to lock down and resulting in a worse second wave. Does the Health Secretary agree that the UK government failed the public? And had he acted sooner, how many lives could have been saved or restrictions could have been avoided? Will he act urgently to prevent further unnecessary suffering and death in our immediate future by holding a comprehensive public inquiry immediately?
So State.
Thank you very much, Mr. Speaker. Well, I've been working on this pandemic since January of last year. That's when we began work, before the disease was even evident in this country. That's when we kicked off work on the vaccine. I was told at first that it would typically take 5 years to develop a vaccine, and I insisted that we drove at that as fast as we possibly could. And I'm delighted at the progress on that we've been able to make. Of course, it is right that we learn from everything that we understand and everything that we see and all of the scientific advances. We should do that all the way through. This idea that we should wait for an inquiry in order to learn is wrong. But of course, it's also right that at the appropriate time, we then go through all that happened in order to ensure that we're as best prepared for the inevitable pandemics of the future.
Let's go to Sherilyn McCrory. Sherilyn.
Thank you, Mr. Speaker. I'd like to thank my right honourable friend for his visit to the Royal Cornwall Hospital in Truro earlier this week, where we met with staff and toured the site of the new oncology wing, and also looked at the state-of-the-art plans for the new Women and Children's Hospital, one of our 40 new hospitals manifesto promise. Given the gravity of the situation the government faced at the beginning of the pandemic, and considering we now know there was a hugely disruptive force in the form of Dominic Cummings, I'd like to congratulate ministers, not least my right honourable friend, for staying focused on the evidence presented by the experts at the time as events changed quickly. Can my right honourable friend assure me that he will ignore unsubstantiated Westminster gossip and stay focused on delivering the vaccine rollout and our manifesto promises?
So Stay.
Well, thank you very much, Mr. Speaker. I think that's what the public expects us to do. I had an absolutely brilliant visit to Cornwall on Monday of this week, and it was a pleasure to go to Trelisk and to see my honourable friend there and to talk about the new Women and Children's Hospital that we're building as part of the biggest ever investment in healthcare in Cornwall. It's delivering on these priorities on which we were elected and, of course, dealing with this pandemic and keeping people safe. That is what the public want to see, it's what the expectations of the public are, and it's my total focus.
Flag withdrawn, so we go to Mike Wood. Mike.
Thank you, Mr. Speaker. There was no manual to guide governments going into this new global pandemic. but most people feel the government responded as well as anybody could. In particular, over the last 6 months, government has worked well together to deliver a phenomenal amount of testing and one of the best vaccine rollouts in the world. Is the Secretary of State aware of anything that's changed during that time to help the way the government has worked on improving the COVID response?
Secretary of State.
Well, I think all I'd say to my honourable friend is that it is very difficult responding to an unprecedented challenge of this scale. But I think that over the past 6 months, people have seen that governing has become a little easier and we're being able to deliver.
Let's go to Yasmin Qureshi. Yasmin.
Mr. Speaker, in February, I called for localised community-based vaccination centres, and I want to pay tribute to Dr. Helen Wall, Bolton CCG, NHS, and the volunteers for the rollout of the vaccine. Last week, my constituents were wrongfully accused of vaccine hesitancy, and then we had a quasi-lockdown that no one knew about, and many people's travel plans were thrown in chaos. My constituents can forgive the government for that, but I am sure that I speak for the country when I say that we cannot forgive tens of thousands of people who died and didn't need to die. The chilling words of Dominic Cummings. Will the Secretary of State tell me, when will the Prime Minister and others be investigated by the police for alleged corporate manslaughter? And why did we not follow the example of New Zealand, where they managed to control it without a minimum of number of deaths?
No, Mr. Speaker, but what I would say to the people of Bolton is that the people of Bolton have again risen to this challenge. The number of vaccinations happening in Bolton right now is phenomenal. Tens of thousands every single day. And it is heartening to see the queues of people coming forward, both for testing and for vaccinations in Bolton. This has not been an easy pandemic anywhere, but it's been especially difficult in Bolton. And I in particular want to pay tribute to the leadership of Bolton Council and Councillor David Greenall, who's done such a remarkable job in very difficult circumstances.
Let's go to Selene Saxby. Selene.
Thank you, Mr. Speaker. I would like to thank my right honourable friend for visiting North Devon District Hospital this week, where he personally thanked the wonderful staff and discussed future development plans. Whilst this government has worked tirelessly to save lives, protect our NHS, Labour have spent the last year flip-flopping over curfews, lockdowns, schools and our borders. And I'm sure my right honourable friend shares my disappointment that even now the party opposite is still more interested in playing politics than working constructively with us. So can I seek his reassurance that as we emerge from the pandemic, he is committed to lowering NHS waiting times and improving access to vital GP services as he continues to make sure that everybody who needs care gets care?
Secretary of State.
Thank you very much, Mr. Speaker. Absolutely I am, and GP access in particular is very important. And this morning I met with the British Medical Association and the British Medical Association GP leadership to talk about what more we can do to strengthen access to GPs. These are the sorts of things that matter to our constituents, as does the new hospital that we're going to build in my honourable friend's constituency. It was a wonderful visit earlier this week on Tuesday in Devon, and it's been great going around the country looking at what we can do to further invest in the NHS, to strengthen our NHS, to support our NHS to deliver better care. And North Devon doesn't have a better champion than the Honourable Lady. As for what she said about the opposition, all I can say is that sometimes the Right Honourable Gentleman has constructive criticism. He's generally had a good crisis, and maybe he'll return to that approach soon.
Munira Wilson. Munira.
Thank you very much, Mr. Speaker. Quite the opposite of putting a shield around them, we sent people with COVID back to the care homes. These were the words of the Prime Minister's former chief advisor yesterday. If true, this is one of the biggest scandals and tragedies of the pandemic. So can the Secretary of State please confirm when testing on discharge from hospitals into care homes was routinely offered? And will he apologise to the tens of thousands of bereaved family members whose relatives died in care homes?
Secretary of State.
Well, it has been an incredibly difficult time for those who work in and live in care homes throughout this pandemic. That's been true across the world. And I want to pay tribute to the staff who work in social care who've done so much. It was, of course, a difficult challenge, especially at the start when many characteristics of this virus were unknown. And as I've answered many times in this House, we have published the full details of the approach that we take and that we took. And we worked with the care home sector as much as possible to keep people safe. And we followed the clinical advice on the appropriate way forward.
Mark Harper.
Thank you very much, Mr. Speaker. Can I take the Secretary of State back to something he said in his statement, which I think actually is going to be of the most concern to my constituents and the country in the days and weeks ahead, which is what he said about the B1617.2 variant first discovered in India. Now, we're bound to see an increase in cases as we open up. That is inevitable. But the important thing is breaking that link between cases, hospitalisation and death. My understanding of all of the evidence that currently exists is that the vaccines we have are very effective in stopping serious disease, including with that B1617.2 variant. Now, if that remains the case, then on the 15th of June, does he agree that there would be no reason why we wouldn't be able to open up fully on the 21st of June? That's the important question to which we need an answer.
That is literally the most important question, to which we do not yet have a full answer. The data that we have is that in the hotspot areas, around 1 in 10 of those in hospital are people who've had both jabs. But that is, of course, a function both of the protection that you get from the vaccine against this variant and also of the age profile of those who are catching the disease. And those who haven't been vaccinated include those who are old enough to have been offered the jab and those who have not yet been offered the jab. Now, the fact that 90% are people who have not yet been double vaccinated gives us a high degree of confidence that the vaccine is highly effective, but it also shows the fact there's 10% who have been double vaccinated that it isn't 100% effective. We already knew this, but we're better able to calibrate as we see these data. We will learn more about this over the forthcoming week or two before we make an assessment and publish an assessment ahead of the 14th of June about what the data is saying about taking the step that is penciled in for not before the 21st.
Jim Chapman.
Thank you, Mr. Deputy Speaker. Can I first of all thank the Secretary of State for all that he has done to deal with the coronavirus disease and also for the rollout of the vaccine. Mr. Speaker, my mother-in-law died last year during the coronavirus. On the Monday she was taken to hospital and 5 days later we lost her. Now, we don't blame anybody, Mr. Speaker, and I want to put that on record, but we do miss her every day and we continue to do so. I just want to ask the Secretary of State this. There are others who have questions, and there are others who have questions that they need answers to in Northern Ireland. And I just want to ask the Secretary of State this question. Our Prime Minister has committed himself to an inquiry. The Secretary of State has committed himself to that inquiry. And I want to ensure that those people from Northern Ireland who have lost loved ones and have questions, sincere questions, not to blame anybody, Mr. Speaker, but just to ask the questions and get those answers. Can he assure us that people from Northern Ireland who have those questions can and will be part of that inquiry? Thank you.
Secretary of State.
Yes, of course, Mr. Speaker. I'm sure that he, like me, will welcome the fact that this morning Northern Ireland has been able to open up vaccination to all adults over the age of 18, showing the progress that we're able to make, working together with the UK vaccination programme and the local delivery through the Department of Health and Social Care in Northern Ireland. On the question of the inquiry, of course the inquiry must and will cover the entire United Kingdom, and in the 3 nations that have devolved administrations, of course it will have to cover the activities both of the UK government and of the devolved responsibilities. Exactly how that is structured is yet to be determined and will be done in consultation with the devolved administrations. But as he rightly says, it is vital that we use the inquiry to ensure that people can ask questions and get answers in all parts of this United Kingdom.
Let's go to Derek Thomas. Derek.
Thank you, Mr. Speaker. We all everyone recognises lessons that can be learned as a result of this pandemic, and we don't necessarily need to wait for the inquiry to take place. Would the Secretary of State share my view that integration of health and social care is critical, is something that would absolutely be a lesson to be learned from the pandemic? And I was so delighted to welcome the Secretary of State to the Isles of Scilly on Monday, the first, we understand, of a health visitor of any time, and Health Secretary. So will he affirm the model that we're developing on the Isles of Scilly to integrate health and social care, improve the outcomes for everyone living on those islands, is right for those islands, but also a model that could be used elsewhere across the United Kingdom?
So say.
Yes, absolutely. It was an enormous pleasure to go to the Isles of Scilly on Monday morning. I didn't know that I was the first Health Secretary ever to visit the Isles of Scilly, but frankly, it's so wonderful. I'd really quite like to be back before too long. The point that he makes about the integration of health and social care is happening on Scilly. It's important on Scilly, but it's actually a lesson for everywhere. And it's a discussion I was having with the new Conservative-led Cornwall Council as well, the first ever majority-led Conservative-led Cornwall Council. And the team there and on the Isle of Scilly are doing a great job at integrating health and social care. On Scilly in particular, where they need investment in their health infrastructure, the support, because it is more remote than almost anywhere else. These things we will deliver. And what I can tell my honourable friend is that throughout the length and breadth of this country, we will invest in the NHS and we will integrate health and social care. And the Isles of Scilly could hope for no better advocate than him.
Right, let's go to Neil Hamby. Neil.
Thank you, Mr. Speaker. Yesterday's revelations have only served to reinforce what many have suspected. A tale of chaos, deception, dishonesty and failure, including the reckless suggestion of herd immunity and chickenpox parties. While so many watched aghast, the Secretary of State chose to respond to these very serious allegations by claiming he had been too busy saving lives to even bother. My enduring memory of the Secretary of State yesterday will be of him quite literally running away from his responsibilities. I want to focus my questions on one vitally important matter that emerged yesterday regarding deaths in care homes. Did the Secretary of State, as alleged, categorically tell Mr. Cummings and unspecified others that people would be tested before being transferred into care homes? And if he did not, why then was transfer without testing the adopted policy across England and the devolved governments, including Scotland? On the 17th of October last year, I asked the Secretary of State to consider tendering his resignation. Surely, if all of these allegations are substantiated, he must do so.
Secretary of State.
Mr. Speaker, so many of the allegations yesterday were unsubstantiated. And I think the point that, the most important point that the Honourable Gentleman just made was that the Scottish Government, with its responsibilities for social care, also had to respond to the same challenges and dilemmas that we did, as did other countries across Europe and across the world. When we were driving incredibly hard as one United Kingdom to increase testing volumes, and we successfully increased testing volumes, including through the important use of the 100,000 testing target, which had a material impact on accelerating the increase of testing. And because of this increased testing, we were then able to spread the use of tests more broadly. It was the same challenge for the administration in Edinburgh as it was here in Westminster, and the best way to rise to these challenges is to do so working together.
We have a line connection with Dr. Andrew Morrison, so we'll go straight to Caroline Lucas. Caroline.
Thank you, Mr. Speaker. The families of the bereaved deserve better than the grotesque pantomime of the Cummings evidence session yesterday. At the very least, they deserve the publication of the internal lessons learnt review. My constituent, whose father died from COVID acquired in hospital, wrote to me to say that the refusal to release it is, and I quote, an insult to bereaved family members who, in the midst of our own suffering, are determined to prevent other families from experiencing the loss that we have. She's right, because the big question is not just about mistakes the government made last March, but why ministers never learn from those errors and continue on a path that risks lives and livelihoods. So he says he's being straight with the public in this House. So as continued government negligence risks a third wave of the pandemic, will he finally publish that review urgently, not least so that it can be scrutinised before restrictions are due to be lifted next month?
Secretary of State.
Thank you very much, Mr. Speaker. Of course, we learn lessons all the way through, and we follow the scientific developments that teach us more about this virus all the way through. And then we will also have a full inquiry afterwards to make sure that we can learn further lessons for the future. The thing I didn't quite understand about the Honourable Lady's question is why she didn't refer to the single most important programme that is saving lives, which is the vaccination programme. And she should be urging her constituents and others to come forward and get the jab, because that is our way out of this pandemic.
It can be on.
Thank you, Mr. Speaker. Thanks to this government and the Vaccine Task Force led by Kate Bingham, it is Britain who's led the way in vaccinations, and Britain who has given so much to the world through our vaccination technology and innovation. Globally, over 1 billion jabs have now been given, most of those either Pfizer, Moderna or Oxford AstraZeneca, and it is this government that backed Oxford University with over £60 million of funding to give the gift of hope to the world. So can I thank the Secretary of State for his efforts and his remarkable achievements in this regard? And if I may ask him this, when does he think the T-side vaccine, Novavax, will be approved by the MHRA?
So, the last point is very tempting, but I will leave it to the independent regulator to make that decision and to determine the timing of that decision. But we're all very excited about the progress of the T-side vaccine, as he calls it, the Novavax vaccine. But he's also right to raise this point about vaccinations around the world. And this is a critical role that the UK can be very proud of having played. Because of the investment we made in the Oxford AstraZeneca vaccine right at the start of this pandemic, and because of the way that, along with Oxford University and AstraZeneca, we have decided together to make this vaccine available at cost around the world. And I can tell the House, with an update, that there have now been over 450 million doses of the Oxford AstraZeneca vaccine deployed around the world at cost. That is the single biggest gift to the world that we could make with respect to vaccines. It is because of the attitude that this government took, working with one of our greatest universities, working with one of our greatest industrial partners. It is another example of the big team effort that is helping, in this case, the whole world to get out of this pandemic.
Let's go to Mohammed Jassin. Mohammed.
Thank you very much, Mr. Speaker. In a PMQ in July, I raised the concerns of a care home owner in Bedford who was told as late as the 21st of May that if she refused to accept the return from hospital of a COVID-positive patient, they would be discharged to an unfamiliar home. I know the Secretary of State is desperate to dismiss Mr. Cummings' events on care homes, but to do so would mean calling the care home owner a liar. Who is responsible for these high numbers of unnecessary deaths? The Health Secretary or the Prime Minister?
Well, Mr. Speaker, as I said, we've answered this question many times before, and what I'd add to those answers is that it's another example of constantly learning about the virus. As we learned the impact of asymptomatic transmission in particular, so we changed the protocols in care homes over the summer and put in place the winter plan that led to a greater degree of protection in care homes over the second peak. And we're constantly looking to make sure that we can learn as much as possible and work with the sector to help people stay as safe as possible.
Mark Logan.
Thank you very much, Mr. Speaker. And when it comes to the Health Secretary, I'm a fan. Those are not my effusive words. They come from some of the highest levels amongst our health team in Bolton. Like colleagues on both sides of this House, we've been on countless calls with the Health Secretary, with upwards of 100 MPs on many occasions, and like today, he has taken the time to respond or come back after each and every interaction with helpful advice and solutions. I say this in private, I say this in public, and I say it in today's Times Red Box. That's a plug. These last 2 weeks, he has thrown the Health Department's kitchen sink at Bolton to help us through the recent variant-driven spike. Can he provide an update on the current situation, as well as giving continued commitment to work hard for Bolton?
I presume it's your red box he refers to, Secretary of State.
Well, there are issues around Bolton in my red box very regularly, Mr. Speaker. I was waiting on tenterhooks to find out if, as well as his constituent being a fan, my honourable friend is a fan, and I'll maybe he can tell me later in private. But he makes a very serious point, which is that we have a significant challenge in Bolton right now. We have a high rate of COVID transmission, and we have done everything we possibly can to support Boltonians to solve this problem with increased vaccination, and it's great to see the huge enthusiasm for vaccination and the queues of people coming forward. And I would say to everybody in Bolton, please come forward if you haven't had both jabs yet. And secondly, the testing effort, which has seen people come forward and get tested and is helping us to break the chains of transmission. That is the approach that we're trying to take now that we've built this huge vaccine and testing infrastructure over the past few months.
Let's go to Matt Weston. Matt.
Thank you, Mr. Speaker. The Secretary of State claims that he has always been straight, yet his response to my question last week suggests otherwise. Remember, he was not straight over the need for higher grade FFP3 masks for our frontline NHS and care workers. He was not straight over the need for the public to wear masks at the start of the pandemic. And he has not been straight over test and trace, such as his fabricated test numbers last April. Given yesterday's revelations, however, will the Secretary of State apologise to Warwickshire families for the 344 excess deaths resulting from his decision to discharge hospital patients directly into our care homes?
I don't recognise those figures, but I do recognise the enormous challenge of keeping people safe in care homes in the height of a pandemic, in unprecedented circumstances. But the other thing that I would say, Mr. Speaker, is that in the Honourable Gentleman's constituency, we are building one of the biggest testing laboratories that this country has ever seen, if not the biggest. And the ability to have this huge testing capacity is an asset that this country has, which will mean not only we can help tackle the virus now, spot the new variants, and make sure that we have an understanding of where it might be popping up, like, for instance, in Bolton, but also that we're better prepared in the future. And what I'd like to do with the Honourable Gentleman is work with him to deliver this brilliant laboratory in Leamington Spa, and to make sure that it is a model for how we do diagnostics for the future. And I think that, working together, is the best approach we can take.
We've got an audio only with Dr. Andrew Morrison. Andrew.
Thank you, Mr. Speaker. How does my right honourable friend account for the yawning difference between the account given to the Select Committee yesterday and rehearsed by the opposition today, and the balanced and objective accounts that continue to be given by the National Audit Office on this pandemic, notably the one published earlier this month detailing the government's response to the pandemic? And can I ask him specifically how he will be taking forward one of the principal recommendations of that report, that we need to be planning for a sustainable healthcare workforce that can be organised at pace in the event that there is a future emergency of this sort, and particularly individuals who are properly skilled and updated to fill gaps that may arise as a result of a future pandemic.
he's quite right on both points, Mr. Speaker. Not only have we been transparent and accountable to this House and straight with this House about the challenges, but we have also welcomed the National Audit Office into government throughout this pandemic, and it has published repeatedly. For instance, it published on PPE, showing that we successfully avoided a national outage of PPE. It has reported on every aspect of the pandemic, and we have learned the lessons that are within those reports. And I recommend to the House the National Audit Office's latest publication, which summarise all of these lessons and learnings. And he's absolutely right that one of those is making sure that we have high-quality workforce planning for the future.
William Bragg.
Speaker, has my right honourable friend noted the various ironies of yesterday's committee? It must be personally difficult for him and others who needlessly defended someone so willing to throw them into the road, full of those presumably behind wheels of those testing their eyesight. But, Mr. Speaker, is not the greater irony, the strange epiphany in many who have gone from regarding the Prime Minister's former adviser as a latter-day King Herod, whose words and deeds could not be trusted, into a prophet who, fresh from the wilderness, brings with him supposed truths written on tablets of stone? Mr. Speaker, irony of ironies, all is irony.
Secretary of State.
I think, Mr. Speaker, what the constituents who we serve are looking for is a government that is focused foursquare on delivering for them, getting us out of this pandemic and building back better. And observations on ironies I will leave to my honourable friend.
Let's go to Chris Stevens. Chris.
Thank you, Mr. Speaker. Delaying a public inquiry until 2022 could see the rewriting of memories, the potential loss of key documents, and a lack of the full transparency with the decisions that were taken based upon the evidence. Given the seriousness of the testimony of Mr. Cummings' comments, including the statements, the scale of the disaster is so big that people need to understand how the government failed them and learn from it. Does the Secretary of State agree with me that we need to now see a quicker start to a public inquiry than the government currently plans to?
Secretary of State.
No.
Right, let's go to Peter Bone.
Thank you, Mr. Speaker. What do we know about the Secretary of State? Well, we know he's exceptionally hard-working, that every day he woke up to try and save lives. He's been exceptionally good at coming to this House and answering questions. He's also held press conferences and answered questions from journalists. And yet yesterday we had some outrageous claims by an unelected SPAD who broke COVID regulations, admitted he'd leaked stuff to the BBC, and by his own admission wasn't fit to be in number 10 Downing Street. Mr. Speaker, would the Secretary of State agree with me the only mistake the Prime Minister made in this pandemic is he didn't fire Dominic Cummings early enough?
Secretary of State.
Thank you very much, Mr. Speaker. I'm very grateful to my right honourable friend for that question, and I'll continue to compliment him whilst I think of how to respond. The honest truth is that from the start, I've been totally focused on how to get out of this pandemic. It is absolutely true that the operation and functioning of government has got easier this last 6 months. And I think all the public can see that. And we are laser focused on getting through this, getting this country out of it, delivering that vaccine programme, which we've now been working on for almost a year and a half, which is remarkable. And I pay tribute to all those who've been working on this effort. The way to fight a pandemic is by bringing people together and inspiring hope.
Let's go to Rushanara Ali. Rushanara.
Thank you, Mr. Speaker. 519 residents in my borough of Tower Hamlets lost their lives to COVID. In my own family, we lost 5 of our relatives, and their family members are grappling with that loss to this day. The hearings yesterday were incredibly distressing. Mr. Cummings has admitted to government failures in handling the pandemic and said it meant tens of thousands of people died who didn't need to die. Out of respect to those families, the over 128,000 families who've lost their lives, will the Secretary of State admit to the failures today and apologise? And will he, instead of a simple no to the earlier question, will he bring forward urgently the date for the inquiry? Because families like ours and my constituents and all those who've lost loved ones up and down the country deserve answers now, and they deserve for lessons to be learned so that these mistakes are never made again.
Mr. Speaker, the pandemic has taken far too many people away far too soon, and that's happened in her family and it's happened in mine. And she's absolutely right that we need to ensure that we learn as a country how to prepare as well as we possibly can for pandemics in the future, because it is likely that pandemics will become more frequent, not less. And it is vital that people have the opportunity to get answers. And we must learn the lessons all the way through, not just wait till afterwards. And we must have a full inquiry afterwards so that we can ensure that every detail is assessed and that everybody has the opportunity to ask those questions. And I think that is the right approach.
Thank you, Mr. Speaker. On Sunday, I had the absolute joy of going to the Winding Wheel in Chesterfield and receiving my first vaccine. Will my right honourable friend thank all of the volunteers and staff at the Winding Wheel for what they have been doing? And can he tell me what monitoring has been happening at the Department of Health of an outbreak of opportunism and revisionism that seems to be spreading through opposition politicians? And if it helps, I have an idea of who patient zero might be for that outbreak. Captain Hindsight, if you will.
Be delighted my honourable friend has had his first jab. I didn't know he was old enough yet. But it is very important that you take decisions in government based on the information that you have at the time. And of course, afterwards, you can go and assess based on information you have afterwards. But you can only take decisions on the information that you have. And that's why an unprecedented crisis like this leads to unprecedented challenges. And what you have to do is tackle those challenges as best as you possibly can.
Let's go to Barbara Keeley. Barbara.
Thank you, Mr. Speaker. At the start of this pandemic, COVID-19 was seeded into care homes by a discharge policy which required care homes to take asymptomatic patients. A letter from Kent and Medway CCG to care providers dated 26th of March 2020 made clear they were asked to take such patients whether they had been tested or not. Yesterday, the Joint Select Committee inquiry heard that the Prime Minister was told by the Secretary of State that testing would be in place for these patients. So I'm asking quite specifically, did he know that the discharge process did not require testing? And did he sign off this policy, which led to thousands of avoidable deaths of vulnerable people and many deaths of care staff?
Well, I've answered this question many times, and the challenge is that we had to build the testing capacity. And at that time, of course, I was focused on protecting people in care homes and in building that testing capacity so that we had the daily tests to be able to ensure that availability was more widespread. That is at the heart of the importance of the then 100,000 target, and we're now up to a position where we have millions of tests available per day.
Andrew Mitchell.
Thank you, Mr. Speaker. Surely, Mr. Speaker, it cannot be in anyone's interest, least of all those who are mourning loved ones, for the mob to descend and judge and preoccupy my right honourable friend. At this point in the pandemic, the government has made clear there will be a full public inquiry, and that is when hindsight can and should prevail. But now surely it is in all our interests that he gets on with his work, bringing his experience to bear, saving lives and carrying out this excellent vaccination programme. In which connection will he meet a cross-party delegation of West Midlands metropolitan leaders who are keen to work with him to deliver these common objectives?
Yes, Mr. Speaker, these are common objectives. The way my right honourable friend puts it is absolutely spot on, and I'd be delighted to meet with him and the West Midlands leaders to ensure that we can roll out the vaccination effort as quickly and effectively as possible in order both to save lives and get us out of this pandemic.
Let's go to Barry Sherman. Barry.
Thank you, Mr. Speaker. Is the Secretary of State aware that, by and large, many of us have been in the Parliament for a long time, prefer select committee inquiries to public inquiries because we get a faster and sharper look at a problem while the evidence is fresh? But can I say that he, I know, has been very good at coming back quickly to members of Parliament, and myself in Huddersfield, in Kirklees. Last week wasn't as good as possible. He didn't give a heads up, or it seemed didn't give a heads up, and we were very much taken aback by the new advice given to local authorities like mine. But one last point, the fact of the matter is these pandemics, these viruses haven't gone away. And the disturbing thing that came out of yesterday's evidence was there seemed not to have been any national plan in this sort of emergency. Every local authority has an emergency plan. Have we now got one?
Well, of course, we've learnt a huge amount about how to respond to a pandemic, and we've built assets and capabilities like the vaccination programme, like the testing, which is so important both to protect people directly and break the chains of transmission and to understand where the virus is spreading. And I'm glad that we cleared up the issue that he raised with respect to Kirklees, and I worked with colleagues in Kirklees and elsewhere whilst I was in the West Country to make sure that we got the best possible solution to the need in Kirklees to have turbocharge on the vaccination programme, to have mass testing to break the chains of transmission, and for people to be cautious and take personal responsibility as we lift the measures to make sure that things stay under control. And I'm very grateful to him for what he said about me personally, and I'm very grateful to him for the leadership he's shown in his community.
Let's go to Dr. Luke Evans. Luke.
Yesterday, our committee was supposed to be about lessons learned, and in that spirit, we know that the World Health Organization on the 14th of January stated there's no human transmission. On the 11th of February, the WHO actually named the virus. We then know that on the 14th of February, the European Centre for Disease Prevention and Control, in update number 4, stated that the risk to health systems in the EU and the UK was low to moderate, and the risk to the population was low. We also know the UK had a plan, but it was mainly based around flu, not brand new viruses. Now, obviously, look where we are now. Isn't the biggest lesson learned is that we need a global response and a global resilience plan? So will the Health Secretary be pushing the Prime Minister to make this case at the G7 when we host it here in the UK in June?
Thank you very much. I think that is one of the lessons. I don't need to push the Prime Minister on this. He's absolutely seized of the point. And we will be developing the work on this next week at the Health Ministers G7 that is being held in Oxford. And then, of course, at the Leaders Summit being held in Cornwall later next month. My honourable friend is absolutely right in the view that he takes as to the importance of reforming and strengthening the global institutions as well as learning the lessons here at home.
Patrick Brady.
Thank you, Mr. Speaker. He spoke earlier about the donation of surplus vaccines and other PPE and medical equipment to India and other developing countries. How does that square with the government's determination to cut its overall contribution to international aid? Is those donations being counted towards the 0.7 or the 0.5% targets? And can you assure us that if it is, that's not going to be to the detriment of other projects that were already committed that are towards those targets?
Of course, we're donating items directly, for instance, to India, to Nepal and others. But the single biggest global contribution that the UK has made is the Oxford vaccine, which is being delivered at cost by AstraZeneca around the world, following funding from Oxford and AstraZeneca and the UK government. That has already led to 450 million jabs globally. 2/3 of which are in lower and middle income countries. It's something everybody in all parts of this country should be proud of. And there was Scottish support in the development of that vaccine as well. Of course, we'll do as much as we can within the ODA budget directly, but that decision to waive the IP charge has been called upon from others, from President Biden down, but it's something that we in this House and the whole country should be very proud of.
Final question, Steve Bryan.
Thank you, sir. The vaccine rollout is going really well in my area, and I can't help but note the turning of the tide against COVID, exactly because of that rollout, seemed to exactly mirror the turning of the year. Isn't it the case, Mr. Speaker, that far from the world being divided into people who are either useless or brilliant, and the British state failing at every turn, we have a government in this country that did its best and a public who came together, as always in the UK, when the chips were down?
Seriously,
my honourable friend served as a health minister, was a superb health minister, and has captured not just the spirit of what this country has been through in the last 18 months, but also the spirit of the debate today in this House. The truth of the matter, Mr. Speaker, is that we work best when we work together, and we work together when we have a common mission, and the common mission has been tackling this virus. And it is absolutely true that we must always do that with an open mind to how we do it better in the future. But in my view, the attitude you need to take is one where you welcome people in and you take things forward in a spirit of positive partnership. That's how you get stuff done, and that's how we've made the progress we've been able to make.
Order. I'm now suspending the House for 3 minutes to enable the necessary arrangements to be made for the next business. Order. Sir, I call Emily Thornbury to ask her urgent question.
Thank you, Mr. Speaker, for granting this urgent question. Can I ask the Secretary of State for International Trade to make a statement on the United Kingdom's proposed tariff offer to the Australian government on their agricultural exports?
Minister.
Mr. Speaker, our trade agreement with Australia is very likely to be the first from-scratch deal that we have struck outside of the European Union. This is a major milestone for global Britain and a major prize secured for our newly independent trade policy. It is on course to slash tariffs on iconic UK exports, saving business potentially around £115 million a year. The deal, Mr. Speaker, will be the most advanced that Australia has struck with any nation, bar New Zealand, and will, we expect, be particularly forward-leaning in areas such as services, procurement and digital trade. This will be a great deal for the UK, and our farmers will continue to thrive. The agreement is a gateway into the massive CPTPP free trade area in Asia-Pacific, opening doors for our farmers into some of the biggest economies of now and the future. Our food is among the best in the world and incredibly competitive. We should be positive, Mr. Speaker, not fearful of the opportunities that exist for our agriculture and our farmers. We give the EU preferential trading terms, which I don't recall the opposition benches objecting to. We should be unafraid of giving our Australian cousins something similar, taking the chance to deepen trading ties with one of our closest friends and closest allies. Australian meat, Mr. Speaker, is high quality, produced to high standards, and arrives here in low volume. Meanwhile, Australia has some of the highest animal welfare standards in the world. The UK accounts for just 0.15% of Australian beef exports, and our analysis suggests any increase in imports is more likely to displace food arriving from the EU. Any deal we strike will contain protections for our farmers, any liberalisation will be staged over time, and any agreement is likely to include